Our bodies have many ways of communicating with us, and sometimes those messages can be a little confusing or even alarming. When it comes to reproductive health, noticing something unusual, like bleeding outside of your regular period, often brings up a lot of questions and can cause worry. It is completely natural to wonder what these changes might signify. Yes, irregular vaginal bleeding can indeed be a symptom of cervical cancer, but it is important to know that it is more commonly caused by many other less serious conditions. However, because it can be a sign of something significant, any new or unusual bleeding should always be discussed with a healthcare professional promptly. Cervical cancer develops in the cells of the cervix, which is the lower part of the uterus that connects to the vagina. When abnormal cells in the cervix grow and multiply uncontrollably, they can become cancerous. As these cells spread, they may damage surrounding blood vessels, leading to bleeding, especially after irritation like sexual intercourse or douching. This type of bleeding is often described as contact bleeding and is a key indicator to watch for. If you experience irregular bleeding, it is important to schedule an appointment with your doctor. They will likely start by taking a detailed medical history and performing a physical examination, including a pelvic exam and a Pap test. During a Pap test, cells are gently scraped from your cervix and sent to a lab to check for any abnormalities. If the Pap test shows changes, your doctor might recommend further tests, such as an HPV test or a colposcopy, to get a closer look at your cervix. Remember that the human papillomavirus, known as HPV, is the primary cause of almost all cervical cancers. While HPV infection is very common, only a small percentage of women who have HPV will develop cervical cancer, especially with regular screening. Getting vaccinated against HPV and attending your routine cervical cancer screenings, like Pap tests, are powerful steps you can take to protect your health. Understanding the potential causes of irregular bleeding empowers you to take proactive steps for your health. While cervical cancer is a possibility, many other factors, such as hormonal changes, infections, or benign growths, can also cause irregular bleeding. The most important action you can take is to listen to your body and consult with your doctor. Early detection, regardless of the cause, is key to effective treatment and maintaining your well-being.